Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name's Julie. I had my treatment in Leicestershire because I moved to Leicestershire, but originally I was born in Derbyshire and lived in Nottinghamshire, Derbyshire and now Leicestershire. I am married and I have a daughter of 12. I've worked in the health environment for many years in an administrative capacity, and I am an identical twin, which is quite unusual. Is that all right?
That's perfect. So Julie Charlish has come in today and she's going to tell us a little bit about her cancer experience, her journey through the cancer diagnosis, and after the diagnosis, what's happened since then. Is it okay to ask you about how the diagnosis first came about?
Yes, that's fine, yes. Well, basically I went for a standard mammogram because of my age. In fact, I was slightly under the age of 50. I'd never had a mammogram before in my life, and I was recalled, and basically I went back to the hospital and I had further mammograms of both breasts and an ultrasound which picked up the fact there were some changes taking place, and also a core biopsy. And then I was asked to go away and come for the results, but I was told at that first visit that there were changes taking place in my left breast and that I would need further treatment.
And what was the next step after that? Because that was leaving you with a sense of uncertainty, I guess.
Yes, I was very anxious. I was anxious even when I got recalled. So much so that I was nearly physically ill actually during the mammography that was taking place. But I was also very anxious during that wait period to get the results of what the biopsy had shown. Basically as to what we were dealing with, how big it might be, the area, and things like that really. Yeah.
And when was it that you actually were told about the cancer and the fact that they had made a positive diagnosis?
I was told quite bluntly, first of all, which was a bit of a worry and a disappointment to me, during my first consultation when I'd been recalled for mammography at the hospital, to say that there was an area that they thought was showing change in the breast, and that was picked up by ultrasound. And I was told there and then that it was likely to be some sort of cancerous change, when I inquired as to what would happen next, unfortunately for me, I was sort of told quite bluntly that, well, we're not going to leave an area in there, it needs to come out. Which I was a bit taken aback at, really, because I knew that, basically, I suppose what I was asking for was what happens after you get your biopsy results and things like that. So maybe the communication could have been a bit better there, really. But after that was the first time, but when I was physically told I'd actually got cancer and that I would need an operation, was the second visit, when I was told after the results of the core biopsy that yes, there was definitely a cancerous area there. I cannot remember, due to the stress of it, if they'd said the size of the area they were dealing with at that stage, but I certainly remember looking at the clock and thinking, gosh, it's 11 o'clock in the morning, somebody's just told me I've got cancer. And then I just fell to pieces, really, there and then. I broke down, I couldn't speak or anything. I was thinking all about my daughter, her age. I unfortunately lost my mother 8 years before that with a different type of cancer, which was stomach cancer, and because the outcome for her hadn't been so good, I automatically felt it would be the same possibly for me. But I think it was shock and all those things going through your mind, really.
Were you attending on your own for that critical
No,
meeting?
I mean, I had good support. I had my husband there, and I also had my sister there, but that made it worse for me in a way, because she's a twin to me and we're very close, and I could see her face as I was being told the diagnosis. And she was as shocked as I was, and obviously it was a difficult time. Yeah.
Now, looking back on it now, because some time has passed, do you feel that the medical staff handled it as well as they could, or do you think there was a different way to do it?
I think they were very nice in a way, that the doctor who actually told me you should know that we don't leave cancer in there and it comes out, was very blunt in her approach. However, the consultant that came in when I was really distressed, and that they were all in the room, plus the breast support nurse, the consultant actually said, well, I think Julie's, reacted quite strongly to this because of things, obviously, and me personally, my experience before with cancer in the family. And so they chose to take me away for a cup of tea, which was quite nice. And then I did actually calm down a lot. They took me to a different environment. You weren't in a consulting room where you'd been examined. You weren't sat on a couch. It became less medical, and you were taken to a small room where you could have a cup of tea, and the nurse sat there and said, well, you think it's bad because you've heard that scary word cancer, and it is a very scary word, but at the same time there are all different grades and types, and it's not necessarily the end when you're told that that word is applicable to you, but it's what you think of immediately.
Most of us imagine, if you hear that word, you imagine the worst, don't you?
Yeah.
Imagine the worst case scenario.
Yes.
But it's good that the nurse there, I mean, it's a multidisciplinary clinic, and it's good the nurse was saying, well, look, we're going to help you, basically.
Yes.
And there's options for you.
Yeah, she did. And they didn't bombard me at that stage either with decisions about, would you be preferring, you have an option because of the size of the area that we're dealing with. I immediately thought, oh, mastectomy, but she said, no, you could have a wide local, excision. And I will say they were very good, and they did explain to me that they went in twice normally, and if they didn't get full clearance around the area they were dealing with, then you may have to proceed to mastectomy. And they did give me about a week to 10 days to decide which one to go for, and an opportunity to go back to clinic if I decided to go for the bigger up, the mastectomy, to see the consultant on a one-to-one who would talk me through it and tell me what to expect. So that was very positive, that was very good, I felt.
So what actually happened next after you had a chance to think about the options?
I must say, I took the booklets home with me that I was given about the different types of operation, and I was quite distressed. Within the first couple of days I couldn't actually look at that. Basically I didn't want to know until mentally I was ready to address the types of operation. And I did get there, I did look at those, and I decided to go for the wide excision, because although some people might think, let's go for the mastectomy first, your thought is, yes, let's get rid of this cancer. I think it's very important that physically you feel that no matter what operation it is, that you are taking control, that you are saying it's a bad thing, but I am going through this painful process, perhaps emotionally and physically more so, of an operation, whatever it is, whether it's an excision or not, to get rid of the cancer. You know, I'm getting, my reward is that I will feel the cancer's being dealt with. We've gone to the first stage. So I opted for the wide excision, and I thought, well, I'll see how that looks, how I cope with it, and then if I had to go to mastectomy, at least I've gone through that first stage. Me personally, if I could help it, I didn't feel that mentally, emotionally, I would cope with having a mastectomy straight off. So I was willing to take that risk of having to have wide excision and then having to proceed to a mastectomy. But of course not everybody feels like that.
How do you feel the operation went?
It went very well. I was a bit upset that on the day I had my operation, the one bad thing is I was in the hospital at 6 o'clock in the morning. I had to be there for 6 o'clock, and I still hadn't been called down to theatre by about 2 o'clock, 2:30, which is a lot of stress time, sitting with a theatre gown on, with people coming and going. In fact, it was such a long period of time that the anaesthetist actually changed who was due to assist during my surgery. And so another one had to come in and talk to me about, you know, how I felt, and we had to start again. But once, funnily enough, my husband, who went with me, was more anxious on the way down to theatre than I was. I don't know whether that was pre-medication to some extent, but I don't think it was. I think that myself, I had made that decision that, well, here we are, we're going down this road, the trolley's going over the line into theatre, and it's out of your hands now. You know, people are just going to do their best for you. And I was quite calm about it, actually. I felt quite strong at that point. Yeah.
Did you think it was maybe reassuring that you were actually having a treatment rather than waiting around for something, even if things had gone a little bit wrong in terms of delays?
Yes.
The fact is you were actually about to have the treatment. Yeah,
I think you felt that this was the first step into putting something wrong right in that way.
Now, on the other side of the coin, did you feel you had enough information about what was going to happen as a result of the operation? In other words, had you been given a chance to talk to other people about it or anything like that?
I was given the opportunity to talk to the nurses on the ward beforehand, and they came and spoke and said, you know, do you understand what's going to happen? And I said yes. And also a very nice touch that I thought was my consultant, Miss Shikui. She stuck her head around the door, and I know she's a busy lady and she got a theatre list to do that day, and I was just one of many patients on that list that she was dealing with. And some obviously were going to be small operations, some were going to be bigger and more stressful for her and the patient. And I thought it was very kind the way that she kept me in the room and asked me how I was, and, you know, spoke to me, because that gave me some sort of reassurance that she was still there, that she got my best interests at heart, and that helped as well. And the anaesthetist, the same, was quite good like that, you know, and you know, had a chat with me about things. So yeah, in that way, that helped. Definitely.
What was your experience of the wards as a whole, being on the medical wards?
The medical ward I found was quite unusual at the hospital. obviously they were all ladies in beds. I actually was in a side room off the ward, which had pluses and minuses. In the end, because of something else that happened to me externally, it was a plus. But in the beginning, I would say it was a minus, because you felt isolated. I was there with my thoughts for quite a long time and my worries. I couldn't go to another lady and say, hi, my name is Julie, and you know, are you having an op today, and how do you feel, and I'm a bit scared. And we couldn't talk about our worries and things, and also you couldn't say that to the nurses. It was just a case that you were in that little room, and it was just really getting through that time until you could have your op and then see after. So in that way, that was a mixed experience for me, definitely.
Now you were discharged home, and then I wonder how long it was till you started to feel more like your normal self again after that big operation.
It was a very long time, I have to say. The surgery I had in my breast, when they showed me at discharge on the ward, the nurse took you into a room and took the dressing off and showed you the scar, the extent of the surgery. I was really frightened about that until I was actually shown. And then when I was shown, it wasn't too bad at all. It was a lot better than I was expecting. One of the problems I had was when I did get home and I was discharged, I was very fearful about the scar and getting it wet and showering, and more importantly, the scar I had under my arm, which was where lymph nodes were removed, was the most painful actually, and that was quite sore, and it just looked quite ugly, and to some extent I still think it does. But I was pleasantly surprised with the scar that I'd got, but it was very painful. And I must admit, when I got home, the first thing I thought about then was, oh, they've done the histology, the biopsy, they've taken the area out. Gosh, how bad is that going to be? How big is it going to be? What grade is it going to be? How serious is that going to be for me? And that became quite a big worry for me all the time. Yeah. So I would say it was a long time that you were torn between trying to be normal and people were trying to jolly you along and see you as normal, against your own personal worries there that you know you could share with people if you wanted to, but sometimes I think I personally was quite numb. I was in a numb state. I didn't know what to worry about first, really. Even though I know I was taking an important step to dealing with my illness, it was still very frightening, and of course there's delays all along the way.
When we've tried to look at the psychological and emotional aspects and maybe helping train staff who are dealing with these situations, we've focused a lot on that information giving, communication around the bad news of the diagnosis.
Yes.
But obviously we realise now that it's not really just about that point of diagnosis, is it? It's everything that comes after that. It's not even just about the surgery, it's about other treatments and then getting back into your normal life after that. And there can be many steps involved.
I think for me, one of the worst things, if I could help with my experience, is to say, when you're told initially that you've got cancer, and until you've had your operation, they don't really know the severity of the cancer, the size of the cancer, what treatment you may have. I think sometimes it would have been better to be told. You are told you don't know whether you're going to be having chemotherapy or not, or radiotherapy. I mistakenly felt that because I was told some of the things I was told, and that my cancer was small and it was early stage, and that word was reinforced several times, which gives you a positive, it then became a big negative when I was called back again after the second wide excision to get more clearance, and that was looked at. That then I would need chemotherapy, and that I would need radiotherapy, and then unfortunately as well I would need Herceptin on a drip. So in a way, that was a double blow, because I'd been confident that, oh no, I'll just have radiotherapy. Sometimes I think it's better to be prepared for that sooner than have that high and then go down to that low. And then of course it meant that for me, I went through chemotherapy, and I did get through that. I did have one tricky moment in that. It's a very busy department. I felt that during the chemotherapy it would have been nice sometimes just to have, although you're told there are people there and there's a nurse there, it would have been nice to have had somebody who wasn't even medical, somebody who was non-medical, but somebody who had insight into cancer and the way you're feeling. Somebody, you know, who's got psychological support for you to be able to chat with you about how you're feeling, about how the treatment's going and things like that. Because by the time I got from chemotherapy to radiotherapy, I was at a very low ebb, and I don't think I'd even realised that myself. And it meant that therefore I had a very distressing excuse me, reaction really during one of my last radiotherapies, purely and simply because I hadn't had that dialogue with somebody, and I'd got an increasing fear of going back into the chemotherapy environment again for the next stage of my treatment. So I began to become very fearful in the radiotherapy sessions, and yet actually physically that wasn't a painful process, but you are very alone during that.
What was it that made the chemotherapy experience so difficult to tolerate?
It was the fact that the cannulations to have the drip set up was becoming more and more painful, as personally for me, my veins kept collapsing. And because of that, I had a fear then every time I went for my next session that it would be like that. You know, that would happen. And sometimes it did, and sometimes it didn't. And I did get a very understanding nurse in chemotherapy who would be very strong with me, and she would come and seek me out, and I had utter confidence in her, and because I wasn't quite so fearful, sometimes it worked and it made the procedure easier. Other times it didn't. And I think as well as chemotherapy is quite tough because you're in a very physical, open environment where people can see all your pain, they can see all your fear, the other patients. And whilst the chemo team might be used to that and used to your reactions, other patients watching that are not. And you're very aware of protecting yourself and protecting the people that can see you. But you know, sometimes it doesn't work like that.
Now, given that you know the setup in the chemotherapy suite, you know how busy it is,
yes,
you know their turnover, how do you think, I know this is a difficult question, but how do you think those supportive needs, those psychological needs could be met within the parameters of what they're trying to give, i.e. the drugs, you know, to a lot of people in a relatively short space of time?
I think that, as I said before, it would be very helpful. It would be a fantastic thing if there was somebody there who, as I say, is not necessarily purely medical, maybe patients that have gone through cancer, who are strong enough to deal with others' reactions, or psychological support
or
available there at the time for people to talk to, because the nurses are so busy, they have such a frantic schedule to get the number of doses of chemo during that day and the phenomenal amount of patients they see. It's not possible for them to sit and have dialogue with patients. They've got to administer and do some of that, but they've also got to be aware that they've got medical issues that they've got to address. And they have, you know, they can't take their eye off the ball with the drips and when they run out, the changeover and things like that. So,
I mean, you're making a very good point here, which I think a lot of healthcare professionals can learn from, which is that sometimes when we're trying to support staff, we support them by by helping them to do more, but it's in an area they're not 100% comfortable with, i.e. the psychological side.
Yes.
And sometimes those busy frontline cancer staff, they have got a full-time job already.
Yes.
And there's only so much time that they can spend with the psychological side. I'm not saying they should ignore that,
No.
they shouldn't, but they also need help and support themselves to do that to the best possible level, i.e. with good quality. And like you say, you can supplement it with things like the peer support from other patient volunteers or psychologists, social workers and other
Yes.
multidisciplinary staff.
I think so, because as I say, it's a very fast environment medically, and there are large volumes of people coming and going with all different kinds of cancer. While I was in the waiting area, there are young people, there are middle-aged people, there are older people. They've all got different needs and different fears, and you know, sometimes just that little chat, even in the waiting areas, instead of putting a TV screen on, which people aren't really watching because they just sat there with their fear basically, instead of doing that, it might be better to have had a more personal approach where not everybody wants to talk, but if people did, they could go to that and have a bit of calm even before they start the chemo treatment, which makes it that much easier for the medical team then to administer. You know, it helps them to have a calmer patient. And having been both a calm patient and a very stressed out, anxious patient, then, you know, I know that happens.
And I fully agree with you about your advice there. However, there is a problem, which is that often the psychological side is not emphasised by the hospital, i.e. they're not funding those areas as much as the other areas. I mean, obviously the medical side is usually funded because it's considered the backbone of any service, but the psychological and emotional side, that would be considered sometimes, perhaps wrongly, a luxury by some departments.
Yeah, I think that the psychological support around cancer is an integral part of the treatment, because not only do you get the physical shock of the pain and the operations around cancer and some of the side effects of the drugs and the treatment, mentally, emotionally, it is a very lonely place to be with your thoughts and your fears if you cannot talk and express them and offload them to help you become more positive in your approach to your diagnosis initially and your subsequent treatments, which may go on for many months and years, in my case, to help you cope with that. And your family are not always the people who are able to do that. So to me, that was an essential support mechanism for me. I don't think I would have got through mentally the process of coping with cancer, even though my cancer in a lot of medical terms was not as bad as other people's, not as severe. It still was a severity to deal with for me, emotionally and mentally. And I think there's got to be quite a lot of importance placed on the support around that.
Let's go forward in time to what happened next for you after you'd maybe completed the next step of treatment. What was the next hurdle? What was the next hurdle that you had to face?
After radiotherapy and the Herceptin, the radiotherapy was not, as I said before, was not painful. It was lonely experience. It was scary experience being there with all these huge machines around you. There wasn't a lot of dialogue about what to expect in radiotherapy, and the next hurdle I'd got was having to go physically back into the chemo suite and have cannulations again, in fact more than I had for chemo. And I'd got to the point where really my fear was so great I couldn't walk into the building. And it didn't matter what anybody said or anybody did. The only medical support I got at that time was that the head of the chemo nurse team had offered to come down to see me and talk to me about cannulation. But the downside of that was she told me in no uncertain terms that I might have to have a Hickman's line in my chest, which again, mentally, emotionally, I didn't feel that I, as an individual, would be able to cope with, because it was a constant reminder in the mirror when you took your clothes off or whatever, or even it's quite a visual thing to keep looking at to reinforce the fact you were on a drug for cancer. Whereas mentally, emotionally, you're trying to move away from that cancer thing. You don't want a constant reminder that you're undergoing the treatment necessarily. You know you have to have it, you know it's there and it has to be dealt with, but you don't want to have it in your face. And the other thing she told me was, she confirmed that unfortunately my vein system in my arm that I'd had the chemo in was absolutely shot, and that would probably be an option. At that point, I think I was so terrified and so frightened, I completely broke down. And I don't think I would have even been able to go on the next stage of the treatment had I not then, thankfully, been referred to the psycho-oncology department. And I was able to start in a non-medical environment, offload and speak to somebody about my fears about the cancer, my fears about the treatment, my fears about the future, and to get some medication which would calm me and help me stop having like panic attacks, because I was at that time not able to put my foot through the door without having some sort of reaction.
So you had the support and you had the medication options. Now, let me just imagine for a second that you were in a different environment where you had those same fears and worries, but there wasn't a service that you could be referred to. Sitting here now, is there any way you could have still got help, or managed to resolve some of those very real worries at the time? If the referral option wasn't there, I'm just trying to think for other patients, in different settings, they might not have that option. But you've been through it, you've seen, both sides, as it were. Yes,
I think for me, I definitely wouldn't have been able to successfully get through the cancer treatment, the next stage of the treatment, which was the Herceptin, drips and cannulation that went with it, unless I'd have had the support of the psycho-oncology team. I was in constant contact anyway with my GP, he was very understanding, and I was also in contact, of course, with my oncologist. But at the end of the day, there was only the psychological support that comes from the psycho-oncology team, to be able to express your fears without, being keep told, well, you've got to have it, it's an essential part of the treatment. That was a medical essential part of the treatment, but psychologically and emotionally I wouldn't have been able to have physically that essential third stage of my treatment had I not had the emotional and psychological support that thankfully I got. And I would, really feel that is essential to the treatment for not just me, but anybody else that would need it. It was a fantastic service that was provided for me and others.
In terms of your journey, the journey through cancer, you've already taken quite a few steps already from your description.
Yes.
But what was the next step? Was it trying to get back into you get your life back really into what you previously had? Because you were working, of course. We haven't mentioned that yet.
Yes, I was working a few sessions a week in a health environment where I was used to speaking to other patients and people, and that made that quite hard for me. Because obviously I'd had the mental outlook before I got diagnosed that obviously the illness and things was something that I coped with for other people, and it happened to them. When I actually got told I was the patient and I had to cope with those things physically, mentally and emotionally, that was a big challenge for me, very big challenge. And basically, when I got to the end of my journey and I'd had this support from psycho-oncology, I still had that relationship by going there at intervals, that support of speaking to them and being on medication. And gradually, through that process, I went back to work. I was able to cope emotionally with a lot more. You know, I was able to get through my Herceptin treatment. I was able to talk about my illness more. I had a lot more of a positive outlook and attitude after that. And I actually, not only did I go back to work, I went on to do the moonwalk for breast cancer to fundraise for them, which was a huge step really physically to do that, organise it. And I became a lot more positive, and I wanted really the outcome to be good, and it was for me. I used something negative in the experience and turned it into something positive. I also started talking to a lot more people about it who had breast cancer, some of the support groups, which again I learnt about through the psycho-oncology support and to some extent the breast care nurses at the hospital. And now I intend to fully go on and maximise that experience and expand on it in order to help other people, you know, with breast cancer through my experience.
Now, one really meaningful thing you said in there to me is about taking that negative, which could be something small that happens, or it could be this big thing, the whole diagnosis, and trying to turn it into something positive, or something that you can say, well, it was a challenge, but this is what I'm going to do with it in my life. You know, this is how I'm going to add it to my life and then improve myself.
Yes.
How can you actually do that though? Because a lot of people who are receiving a diagnosis for the first time perhaps would not be thinking this is a positive. They'll be thinking this is all negative.
I think that somebody said to me that was very positive. One of the doctors when I was first diagnosed said, this is the worst day of your life, but it's also the best day of your life because we have found cancer and we're able to deal with it, and you know, it's at an early stage. During that time and basically all through the treatment, I never felt like that because I was numb with dealing with it and I couldn't think positively. It was only the fact when I got some help with the depression that I was feeling through the treatment and the loneliness and the isolation by talking and getting support from the psycho-oncology team, that I was able then to see through the fog really and start to think more about myself, what I would like, that there was a future for me and that it wasn't all doom and gloom, and it wasn't all, although I had a scary time, I had got through it. I was brave enough to go through that, and that because I'd done that, I wanted to move on then. I wanted to move on. I wanted to ask something back of life, if you like. I wasn't just a cancer patient. I was a cancer patient that had come through it, wanted to help others, and that gave me a great buzz. That was very, very positive. That feeling of wanting to do something positive, either through educating people to look for symptoms, to encourage them always to go for checkups, fundraising, to get funds into research for the illness, or to help with support groups or services, and that really has given me a big positive. You know, I intend to make that quite a big part of my life now because it's something that I get a great deal of positive energy back from as well.
That might relate to something you said earlier, which is about taking control over things.
Yes.
Rather than just feeling you're just a person who they're doing things to, you're actually, you've got a role and you've got a purpose, and that's going to be something that gives you some fulfillment and helps other people.
Yes, definitely, because when I went back to work, I'd had quite a high profile role where I was training other people. When I got back, my bosses, I think, felt that to protect me mentally and emotionally, that they would remove that area of my role from me, and I had very mixed feelings about that. I felt my confidence took a blow with that. I felt that people were saying, you're not the same person that you were before the cancer. You're not as capable. You are not as confident you are not you, and because they had changed me and my role in the cancer did, I think it's very easy to get down and get depressed and feel that you've got nothing to offer. And therefore as well, that is yet another area of the cancer where you need psychological support to help you feel that you are a whole individual after cancer. You may be battered and bruised, but you are still a whole person. You still have a lot to give in terms of your life and your job and your home. And I think sometimes as well, friends and family think that physically, because you're looking back to normal, your hair's back, and things, that it hasn't affected you. But it does affect you, and I think that is the case whether you're male or female, young or old. That you know deep down that when you look in that mirror, things have changed, and you still have to get out there in the world and go out and do the things that you want to do.
Now, some people might be surprised to hear you say earlier that you felt isolated or a little bit lonely at times in the cancer journey, particularly as you had good family support. And I know there's patients out there, many patients, who actually don't have much in the way of family support just because of the way their life's organised. But what was it for you that made you feel, a little bit isolated in a way?
I think sometimes because cancer is a word now that's bandied about in the press, on the TV, and that a lot of it is very positive, which isn't a bad thing, where people are, they're sponsored, there's the Race for Life, there's, the Moonwalk, there are various big cancer charities where you see the person going through the journey and overcoming obstacles. When the door is shut on all of that and the person is sat as an individual on their own with their own thoughts about their fears for the future and treatments, I think you are lonely because nobody else is carrying that fear with them. It doesn't matter how close your partner, your child, your parents are, you are the only person that is holding that fear. It is you who is wearing that coat. Nobody else is doing that. And you're expected to deal with that. And sometimes you do, and some days you do, and some days you don't. And sometimes people will avoid talking about the subject when sometimes you might want to talk about it. Or I've had the opposite feeling, where sometimes somebody's wanted you to talk about it, and I personally did not want to talk about it, because although that fear was still there and it was getting bigger and bigger and I was getting more and more distressed, I actually would physically sit with my hands on my mouth to stop myself talking about it, because I did not want to unleash all that emotion. I didn't feel that I could cope with the distress of talking about my cancer. So in some ways it can be very lonely,
Now, one of the ideas that's coming up locally and also nationally is about peer support from other cancer patients. And do you think combating that area where you can feel isolated, you can feel like I'm the only one who's had this, even though there's other patients who had it, but you're not really in touch with them. Do you think this idea of peer support, which could be something very simple like a buddying system where you meet somebody who's been through it, ahead of you, or a drop-in group, do you think that could be quite powerful in that situation?
I think so, yes, because it gives the patient the opportunity to offload to somebody that's had a shared experience. All right, that experience might be worse than yours, or it might be better than yours in some ways. But the fact of it is, the most important thing is that you're sharing that, you're talking about it. Your fears might be allayed by that discussion, or they might be heightened by that discussion. But the main thing is you've had that discussion, it's opened doors. I made a very good friend. That was another aspect of the positive side of me being diagnosed with breast cancer. I made a good friend who was having a more serious cancer diagnosis than myself, and I actually met her on the ward at the hospital. She had her mastectomy the day before I had my op, and we are still firm friends now. and we talk about that. You know, we socialise. We don't. It's not always about the cancer. We don't always talk about the cancer. We talk about other things in our lives, what we'd hope for, things that have gone wrong, things that have gone right. But the main thing is that we talk, and we had that bond because we had a shared experience. And I think that support, you know, groups or a buddying thing is a very good way of getting people to outside of the family, where they might want to protect family and not talk about things. For example, I find it terribly difficult to talk to my daughter, who's coming up a young lady, and try to protect her by not talking about the diagnosis and the treatment and other things, because other things were going off in her life that she was coping with. And because of that, again, you've isolated yourself from people within your family support group. And so therefore there is a need to offload elsewhere and get that support, no matter how small or how large that support is, from other people that have had the experience.
Have a think about patients who might be watching this, you know, video later on, and they're getting some very useful advice already, but I wonder if there's any other tips you'd have from what you've been through that you could think, well, you know, I noticed that this was a problem for me and people should watch out for that. Or is there anything else that you can think that you would like other patients to know?
I think that if you feel that you want to, the hospitals normally give you quite a good leafleting area and support with breast care nurse that you can ring. I think for me, there was a drop-in centre at the local hospital where there were leaflets and people you could talk to, because at one point I didn't know whether I was going to be paid about my job and things like that. All those things help to add to your fear and anxiety in general around the illness. I wish I'd known that, for example, you didn't have to have your wig from the hospital site if you are an NHS patient. You could take a prescription elsewhere, mostly. I really struggled with the lack of support around my wig, unfortunately. It just wasn't there, and I had to go elsewhere. But I had to make a lot of inquiries before I realised that there was some flexibility with that. So I think it's important that you try and prepare yourself for that before your hair starts falling out, before your chemo starts. Even if you don't think you're going to have chemo at the beginning of your cancer journey, it might just be wise to explore those avenues before you start chemo, because you don't want the stress of chemo, dealing with hair loss, and then having to look around for your wig. So that's quite a good tip. I think as well, when your hair starts growing back, you should try and empower yourself by making it as funky as you can. If you've had long hair before, go for something really short and spiky and perhaps a bright colour, even if you can cope with that, or, you know, it's not going to damage your scalp or cause you a problem, because then you've said to yourself, well, you know, the cancer has taken part of me, but it's not taken all of me. I am still there, and I'm in the driving seat. So for me, that was quite a good tip to do. And again, I think if you are starting to get distressed and anxious, don't feel guilty about it. Don't feel that you've got to be professional about it, that you've got to be a professional patient who is not showing anxiety. Try and speak to the support network around you with oncology, because you might talk to your oncologist about certain things and say you're worried, and they have, again, they are busy people, they haven't got long in their session with you to go through those things and ask if there are any support mechanisms around emotionally, or if you don't feel able to do it, perhaps you can get a family member to do it.
So maybe one thing is to go and ask what resources are available wherever you are being treated.
Yes, because you do keep coming to the hospital, and it is a bit of a a treadmill that you're on, and you keep coming for the chemo appointment, and yes, that's another one down, and you rush off out of the hospital. And the same for the radiotherapy, and the radiotherapy is quite intense because some of them you have a lot of sessions every day, and it's a big part of your life, and it's easy to go down that road and be getting a bit depressed about it, a bit anxious without realising, and then all of a sudden, like myself, you have a sort of emotional explosion in the middle of it because you've got to that stage and you haven't or been aware of any support mechanism emotionally for you there in place. I certainly didn't know that until I had this situation with radiotherapy.
Now looking back on your treatment as a whole, would you say you're satisfied with the care you received? Would you say the quality of the care you received was adequate for you?
I would say yes, to some extent, not in others. I think that I would have liked a lot more information at the time of getting breast cancer and going through the treatments. Nobody at any time while I was going through chemotherapy, for example, said, well, there are people that you can talk to about this outside of the medical treatments you're being given. Nobody said on that chemo suite. If you are getting more and more frightened about cannulations and coming physically into the chemo, it's become an environmental thing, into the chemo suite and things like that. Nobody at any time said there is somebody who psychologically could help you, or it's not wrong, the feelings that you're having, Julie, you don't have to bury them because you feel that they're bad or that they're not appropriate. You don't have to be the big brave soldier. You can offload that, and you've got every right to feel that way, and there is support for that. At no time was I told that until I'd actually broken down in a public place. That was very distressing for me because having gone through all that emotionally, I was in an area where I was just off a radiotherapy waiting area. Everybody could hear the fact that I was extremely distressed, and my husband had to be sent for to come to me because I wasn't physically capable of walking out of the room. And then I had to walk through a waiting area full of people. Obviously, having been very distressed, I thought that was the very negative thing, to have to get to that stage before help was looked at.
I think what's happening there, if I may, is that the staff are not picking up on something when it's in evolution, when it's bubbling up, and unfortunately, because of probably resources or focus on other things, they're not looking at those emotional sides the same way that, as you said earlier, it'd be nice if they did. But when things go into a kind of catastrophic level, suddenly they all realise, oh yes, we need to do something, and then everybody rushes around to try to help. But by that stage, it's a shame that it's got to that point, isn't it? Because in a way, the earlier you help somebody with almost any issue, the less severe that issue becomes.
Yeah.
It's the same for psychological things, isn't it? So what does the future hold for you?
Well, obviously, I'm still anxious about the future with cancer. I think I've given it my best shot with the treatment I've had so far. I don't think the fear will ever go away. I don't think it ever does. I think if a cancer patient ever said that, they wouldn't really be revealing truly what they felt, because it's like a little seed, and it doesn't go away. It's a little voice in the darkness every now and then that expresses its fear for you, and because of that, I've got involved more now with hopefully wanting to volunteer with the psycho-oncology department, with helping to set up some probably support groups or drop-in areas for patients to befriend others and just you know, nothing too huge yet. It's in its infancy. I really feel that that was a very important part of my treatment, and I feel that I wouldn't be in the place that I am now mentally, emotionally, as strong as I am, if I hadn't had that support. So I now want to go and support others, myself, in that way, with whatever way I can, really, either by my experience, by just listening, or perhaps by, you know, letting somebody offload who doesn't feel that they can offload in a medical or a home environment. For all patients, not just really even for just patients who have had breast cancer, although that is the one obviously personally I've had the experience of, or even in a more distant capacity, not in a one-to-one with the patient, to try and raise the profile of what psycho-oncology does for people undergoing cancer, and, you know, to get the referral rate higher, or to be able to manage that better, and to get funding increased for that service, because I feel it's a very important part of the cancer process.
And maybe that's a message that people can take away, not just for this region, but other areas.
Oh yes, nationally, I think that should be in place anywhere where medically cancer treatment is being provided, because you wouldn't, you know, you wouldn't have an operation and not have medical support there. For example, if you were having a breast operation, the services would be providing breast care support and areas around that. So why not support provided mentally and emotionally for that operation, for the breast, and around that. And the other thing as well is, of course, there is one other thing that I hadn't mentioned before, and that's important, I feel, specifically to breast cancer. And it may be involving other cancers as well, which I have no knowledge of. And that is when you have breast cancer and you are given chemotherapy and your hormones are, you know, messed about with because of the treatment itself, those hormonal problems manifest themselves as well in people, which don't help your mental state and your emotional state, with mood swings and things that you're not expecting. Again, nobody ever sat down as part of the breast cancer treatment process and spoke to myself or a few of the other ladies I've spoken to about hormonally the role that the chemotherapy will play, how it will affect your hormones. They said it would, and you would get menopausal symptoms, but nobody ever said, and if you're struggling with those menopausal symptoms, as well as probably physical things as well about your looks cosmetically, here is psychological support for that. There was no mention of that either. And I know that other ladies have really struggled with that. So to me, yes, you know, make sure there's medical support there, which there is around these big treatments and these operations, but further out from that core, that centre core of the medical treatment, it's essential that you have the emotional and mental support, which I got, thankfully, from psycho-oncology referral.
That's most kind of you to say. Return to a more personal note about what might happen in the future, and I think it's always a very difficult, delicate area to ask, could you face the idea, even the contemplation of the idea of the cancer coming back? Because, you know, when you kind of going through that healing phase, initially it's about how you are now, isn't it?
Yes.
And then you feel a bit better now, and then you start to think, well, what might happen in the future? And I know you said it's in the back of your mind, but could you ever imagine yourself being able to deal with it if you did have to deal with it again in the future?
It's quite a difficult question. It's a very personal thing. Obviously for me, I think that if somebody told me, oh well, you know, the cancer has come back, I would definitely need the support psychological support again. Even though I'm strong now because I'm in this place now. I feel that I'm in control of my life again and my body and things. If my body then decides that things will change and I am not in control of it because the cancer is back there and is to some extent got control at whatever level that may be, I think that because you know and have a knowledge of some of the treatments you've already had, like the chemo, like radiotherapy, and other drips and things, infusions, I think that sometimes that will make it better, because some things you were expecting to be really bad weren't, but some things you weren't expecting were really bad. I think that, you know, I probably would struggle with that, and I don't think anybody can say that they don't. You've got to just face it when it comes, but having said that, facing part of that as well is the mental challenge, and again, long term down that road you need support. More so than medically, I think, because that then becomes the biggest part of your treatment. The fact that you are coping with it, the fact that, oh no, what do I say to people, what do I say to my family, will I still be able to work going through this, how will I feel, will I feel so negative that I can't even cope with the day-to-day process of living my life, getting up in the morning, putting makeup on, going out the door, you know, fulfilling obligations to the family. So yeah, I think that you will always need some sort of safety net around you.
Well, Julie, that's a lot of valuable information on the video, and I want to thank you on behalf of myself and everyone watching this for going through those details, some quite difficult details, in a very honest and open way. And I wish you all the best for the future. I hope things do go well for you.
Thank you.